guys, welcome to our channel. My name is Helen Joe-Attahs.
And I am Joseph.
And we are the
Joe-Attahs.
Welcome. If you are stumbling on us for the first time, then I want to say big welcome. Please subscribe and go through our channel. You will see so many videos on marriage, relationship, and faith and family, and you would find them really insightful. Thank you if you have been here before or watched any of our videos and you found them interesting. Thank you for liking, thank you for sharing, and thank you for subscribing. All right, so today we are going to talk about a very interesting topic, and I think that it's something that hasn't been talked about much, especially in the church. And so we want to be that voice that is talking about it, maybe for the first time, or maybe some persons have talked about it, but not from this angle. So we're excited to bring you this topic. And what are we talking about today?
We're talking about Vaginismus.
The name
is it Greek or Latin?
I'm not sure.
Man, that name is heavy. And basically we're going to be focusing on sex education. Who should be responsible? Is it parent? Is it the culture? Is it the church? Or should it be a joint responsibility? I know that you have an opinion, but of course, let's look at it this way.
Okay.
All right. So vaginismus. When was the first time you heard about that word?
I think I stumbled on it one day while I was on YouTube, and I stumbled on a video. A certain lady
did the writer.
Yes, did with African doctor, and that was the topic. And I was actually hearing about it for the first time, but it's something that I've known, but never really knew that it was a thing. And I didn't even know that there was a medical term for it. So it was just surprising and eye-opening, and there were a lot of aha moments because I was like, oh wow, okay, and it was really insightful, and we took our time to actually further research on it and try to even understand the whole concept and really just understand it in a new light. And that's what we really want to share today.
And before we go further, I really want to say big kudos to Tito the writer. For speaking.
Yes, because I think that it's not something that
a lot of people would want to talk about. The way she was so forward about talking about sharing her experience. And it was such a painful moment for her, and sharing it. She didn't know that she was providing solution to a lot of people, and bringing people to that awareness. Which is why we want to learn our voice. I really want to appreciate that your courage and your boldness. I mean, you have helped a lot.
Absolutely.
Yes, you have helped a lot of people. Okay, now for those who may be hearing about this word for the first time, what does it really mean, vaginismus?
So basically, it's a condition where the vaginal muscles contract, and making it difficult for penetration of any kind to occur, whether it has to be intercourse or it has to do with medical examinations or inserting tampons or anything of such, where the vaginal muscles contract, making it almost, and in some cases completely impossible for penetration to occur. And from what I've seen, it's quite common. It's quite common, although I think that the severity also differs from person to person. For some people, it's kind of mild, and over time they don't even know that it's a thing, and they don't know that that's what it is, right? But they are able to overcome. They are able to overcome it eventually. But for some people, it's severe, and they end up needing therapy, and they end up needing medical attention, basically. So for some people, you might get married and it will be completely impossible for penetration to occur, and because it will be so painful and excruciating that it won't just be possible to penetrate that wall for intercourse to happen. So it's it's just
and you can imagine like Chito's experience, where she was married for a whole year.
For a whole year.
And they had not consummated the marriage in a whole year.
Imagine the frustration.
And if you look at the way she was expressing it, you can see her husband is handsome and she is a beautiful lady. And so they are desiring each other, but because of this thing. And unfortunately, initially, she didn't even know what it was. And she didn't even know if it was something to be concerned about. And to even make matters worse, medically, the people that were attending to her didn't even seem to help so much. And in the end, it was a very serious trauma. Thank God for the victory at last, which is the reason why we are talking about it today. Now, from what she shared, what do you think could be responsible?
So I think that from what I heard her say, and from all of the research that I've done, I think that it's mainly as a result of trauma, right, from the past, probably a bad sexual experience. Maybe the person had been raped or harassed sexually, or maybe the person had had an unpleasant first experience, and then sometimes there is no such negative history, right? But then there is, the fear of the whole idea of sex. There is fear. You're afraid of it, that you fear that it's going to be painful. It's maybe from the things that you've heard, right? It's automatically your vaginal muscles contract upon any attempt, like automatic. You don't have any control. Involuntarily, the muscles contract, and it makes it almost impossible, or in some cases 100% impossible for that penetration to happen. And then in some areas, in some cases, it also has to do with should I say religious and cultural inhibition. So for instance, like in the case of some of us where you grew up, I've always been a church girl, still am a church girl, right? So when you grew up in church, right from childhood, and then you also came from a very conservative Christian background where your parents would literally instill fear in you, and then you also become matured and you get born again, and you're still hearing the same thing. This thing is sin. It's sin against God. It's sin against your own body. So the whole concept of sex feels wrong.
That's right.
Feels completely wrong to you. So even when it now gets to that time when it's no longer wrong, your mindset is still in that place, because it won't automatically change overnight. That's something you've seen all your life as wrong. Now suddenly, those same people are not here now to start telling that it's right. We have been doing it.
How can it's so amazing? Like, how can something be wrong today and be right tomorrow? And that is so hard to actually. That transition sometimes can be very difficult for a lot of people.
So because it's like a very sharp
transition.
It's not something that's gradually, and I feel like that is the role that parents and also the church needs to play. They need to help young women transition. So you don't just carry on the idea of this thing is wrong from childhood to adulthood, and then get married today, and then it's suddenly supposed to be right. So it is a difficult thing, because there's how the mind works, our subconscious mind gets to be established in paradigms. So something that you have known and believed
over the years.
Over the years forms your paradigm subconsciously, and so you act from there, and your body also acts
from there,
responds from there. So even though I now know consciously that this thing is no longer wrong, my subconscious has not transitioned, has not moved with me, it's still there. So subconsciously, it's difficult for me to come to a place where I now enjoy intimacy and intercourse with my husband, because I'm still feeling it's wrong. I know it is right, but my mind is still in that place where it doesn't feel right.
But and then I'm going to. I think there's something. There's a question that's popping in my mind right now as we're talking, because is it right to even say that sex is wrong?
Well, the Bible says we should flee from every form of sexual immorality.
I understand. See, I'm not talking about sexual immorality. I'm not talking about indulgence in either extra or premarital, platform. But I'm saying sex in itself. Is it right to say sex is wrong?
I don't think it's right.
Because I'm asking, it's actually a rhetorical question.
Yes.
Because the reason why I'm asking myself, I'm a pastor, and this thing, we're bound to push them.
Yes.
In an attempt to try to, position the people in an extreme, you demonize something that is actually not as bad as it is. I mean, something that is not bad
at all.
Yeah, something that is not
something
bad at all.
God
for that purpose. Just that it is for a certain. It's like telling your child car is bad simply because the child cannot drive.
Yes.
Yes.
Do you understand? Yes. I think that's a very good, relatable.
Yeah, it's a relatable because that child, just like it is through sex that the child came into the world. Yeah. Now, you can be driving that child in the car, or you will not allow the child to drive because he's not mature for that purpose yet.
Yeah.
So it is not right to say driving is wrong. The way we try to, put away sex.
Yeah.
Okay, that's just by the way. Because, the reason why we are saying this is a lot of people have gone through, imagine the case of Tito, the writer.
Yes.
If not for the kind of husband that she married, mature man, someone who is emotionally mature.
Yeah,
emotionally mature, because that is someone who is a man.
Yes.
He's mature because otherwise, if she had married a child.
With that statement now, you agree with me that a lot of men lack emotional maturity.
Yes, of course. Yes, I agree totally. Most men don't have emotional maturity.
Yeah.
Imagine even courting. Some men cannot even stay with, even if the courtship is 3 months or at most 6 months, as the case may be.
Yeah.
They cannot even stay for that 6 months without indulging in sex. Yes. Some will even tell you abruptly, and now you are married, and then you're having to understand with your wife.
That there's
a reason why.
And this is not.
And for up to a year.
Not a medical.
So we must give that man an award. And for men like that who are able to understand, because this is what it's supposed to be.
Yeah, actually, again, that's how it's supposed to be. Because you need to now come to a place. Remember the other video we talked about empathy.
Yeah.
Right. You need to come to a place where even though you don't fully understand, you can't understand why someone's system is just shutting down and not opening up to this thing, and there's no medical, it's not medical, they are telling you that it's psychological, right? It doesn't make any sense. And for them, for the whole period of 1 year, they didn't even know that it was a psychological thing. So it was going to hospital back and forth, and it was just frustrating. However, you need to be in that place where you're able to empathize, even though you don't fully understand. Yeah.
Empathy. Yeah. And actually, you see, something about marriage is a partnership.
Yeah.
Well, maybe I may be talking like this because that was not my experience. I'm not saying in any way that it's easy. It's not easy. It's not easy. Being mature and expressing maturity is absolutely not easy. But just imagine, she's a good girl, for God's sake, and this man would have just lost a good wife because he couldn't wait through to understand what was the problem. And now, thankfully, they have a very beautiful sex life in their marriage. In the end, of course, and that actually should be the focus of a lot of people. How it ends is more important than how it starts.
Yeah.
Because you have forever, and it's
exactly. Like, of course, you've kept yourself. Even if you didn't keep yourself, right? Because it's not everybody that is able to, even though they should. But if you've kept yourself till marriage, then everybody looks forward to that first night, and then endless romance, happily ever after, and then that doesn't happen. First night, second night, first week, second week, third month, fourth month, up to a year. So it's a lot.
Okay, so now that brings me to our focus. Now, in instances like this, just imagine the man decides to mention something like this to his parents or friends.
Yeah.
You know what the advice will be already.
Yeah.
The cultural,
the Nigerian,
the cultural, the Africanness, and the cultural influence.
Yeah.
Then, of course, the preaching of the church, even though they have told you all the while, we have told you all the while that sex is bad, not to be indulging. Now that I'm from that night, in fact, I can call you and say, okay, so what is happening? I hope you are doing your business. You understand what I'm saying? So suddenly it has become good. And then if it's not able to happen, some people are going to even label the woman, call her names, and probably feel like she's being unfair.
Yeah, she's
depriving the man. Yeah. So what do you think? What do you think that what exactly what can we do, to handle these factors?
I think that it's
maybe we should tackle them one after the other. Let's start with cultural factors.
Yeah, so as per culture, culture will always be there. But like Jesus said, the Sabbath was made for man and not man for the Sabbath. So culture is made for the people. Culture is supposed to serve the people, right? So if it gets to a point where even though that culture is good, but it's no longer serving, then it's time to revisit it, right? And I'm not talking about the culture of, being decent and modest and all of that, right? I'm talking of the avoidance culture, the culture where instead of parents, telling their children what this thing is and why they need to stay away from it, all right? They focus on trying to not mention it, not talk about it at all, and instilling fear in the children. So there's that fear of consequence. There's also the avoidance of it entirely. It's not talked about.
Yeah, sometimes a word not to be mentioned.
Yeah, so you can't be talking to your parents about sex, or you can't talk to your children about sex. It's like the forbidden fruits that should not be eaten. So I think that we need to revisit that, and we need to work on it. We need to, like, for instance, in our case, we have not actively talk to our children about sex because they are still very young. Yeah. But what we have tried to do in that regard is to help them understand the parts of their body. So they know the parts that are private, they know the parts that are public. Yeah. So they know that their hands, their feet, their legs, their head, and all of that, they are public parts. But they know that their breasts, their armpits, their vagina, their penis, their butts and laps, all those areas are private. And they know that even if someone assists them to take a bath, they are not permitted to touch their private parts, right? They know that no matter how they play, they shouldn't play to their private parts. They know that their private parts, their bodies belong to God, and their private parts are for them to honor. Right? And so they are aware, and they call these parts private by name.
Yeah.
So for instance, when I'm helping my daughter take a bath, I'll tell her, wash your vagina. Yes. And she does that. So it's same thing for the boys. So I think that parents need to, so for us, that's a starting point, that they're able to understand this parts of their
body. There's nothing wrong with mentioning the names.
And they're able to call them by their names. So that's where we've started with them. And we believe that as God helps us, when they get to the stage where we should tell them more, I believe that we will be able to talk to them about more of that. So I think that should be a starting point for some people if you have children who are underage. And then when your child begins to get to the age of puberty, you should know that you should sit them down and talk about sex expressly. Now, I'm not when it comes to, before puberty, I'm not sure. I think that it's up to you, really, and let the Holy Spirit guide you. But for me, I don't feel my children are ready at this age, right? And when I begin to feel like I should, I definitely will. But your children shouldn't get to puberty and you have not sat them down and talked to them about sex.
Certain things.
Yes, because at that point their bodies begin to change. They need to understand the changes that are happening. They need to understand why those changes are happening, and they need to understand what to do to, still honor their bodies and stay, sanctified, and and then, to also take care of their bodies even, right? And they need to also understand certain consequences, what sex is. How does sex happen? Expressly.
Yes, what are the consequences?
Yes, they need to understand what is sex, how does it happen, right? and what the consequences are.
Important.
So if these things are talked about, and then they understand that sex in the context is only approved in the context of marriage. God created it for marriage. So if you're doing anything outside of marriage, it is wrong, it is sinful, and there are consequences. Yeah, so they need to understand that. But if they're not of age, it might not make sense at all. So it's important that you speak to them at the time when you feel that they can comprehend what you're saying.
I agree totally. Yeah, actually, of course, it's not every information that you communicate to a child.
Yes.
So you unfold it to them as
phases
as they are able to assimilate and understand. So, but from what you have said so far and from the research we've gathered, I'm seeing something that looks like a collaborative effort.
Yeah,
I think the society has a lot to do. For instance, like the instance I said earlier on, where this man is already married to the wife. Yeah. The wife is already going through a traumatic experience that is already a trauma to her. And then because you are privileged to, or privy to the information because you were told, then you now lash it on her again, calling her names and worsening the situation. That may even further, aggravate the extent of and even delay her healing process.
Absolutely.
Yeah, because like vaginismus is purely psychological.
Yeah,
100%. And 100% psychological. And they said from the research, it's only in few instances where surgery may be required.
Yeah, surgery.
Most times, the only treatment is therapy. Yeah. And the reason for therapy is so that you can bring the person to realign their mind and accept sex as something that is good and should be enjoyed.
Yeah.
And then validate it by themselves and tell themselves that I am going to enjoy sex.
Yeah.
So I think society, if we're able to handle these, like understanding that the two have become one, that is societally, understanding that the two have become one, and then nobody should interfere. Like the Bible said, let no man put asunder.
Yeah.
You should be able to allow the man and the wife to figure out themselves. That is why they need to understand themselves. Remember, they've not lived together. Yeah. It's mostly if they discipline themselves to the marriage. Yeah. And now they're discovering it's a part of growing to know each other. Yeah. And for some, the take-off may be smooth. For others, it may be rough. But be it as it may, I think that the society should allow the two.
Yeah, I think that we live in a world or a society. I think it has to do a lot to do with our African
culture.
Yes, culture. We live in that kind of society where we put pressure on people
unnecessarily. Sometimes.
So you're single.
There's a problem.
You'll be trolled. When are you getting married? Even by aunties, uncles, neighbors, sometimes even parents. Right? When are you getting married? Won't you get married? So. You see so much pressure and people end up marrying for the wrong reason. Then you get married and you see the next question is, how far?
Not seeing pregnancy.
Yes, no show yet. We want to come for Mugo, this and that. So there's so much pressure. And I think that we need to come to a point as a people where we become more sensible and sensitive.
Yes, sensible and sensitive.
Yes, sensible and sensitive. It makes no sense to begin to ask people personal questions after they get married. It makes it's an insensitive thing to do. Because someone might genuinely be going through something.
Dealing with things.
Yes, dealing with something. For instance, this issue of vaginismus. It's not. Yeah. It's not easy. It's not funny. So imagine someone going through this, and then maybe you get to know, and then you're calling them names and telling them that they're depriving their husbands of sex or something. It's terrible. It's terrible. It's a bad thing to do. So I feel like we need to become more sensitive and sensible to get to a point where you're able to just restrain yourself. You know, but you will not say anything.
That's right.
Yes. So you don't have to say. You don't have to ask.
Yes, that is how to be.
Personal.
That is how to be sensible and sensitive.
Yes. You don't have to say it.
I think whatever they want you to know, they will tell you.
Exactly.
What they don't tell you, it's not for you.
Exactly.
And that is how it is.
Exactly.
There's no better way to say it. That's how it is. So it means that from the formative stage, the parents have the sole responsibility to begin the sex education journey with the children. But as they are being integrated into the society, I know that in some schools there are attempts, maybe social studies, there are attempts where they just bring in topics and then probably they just talk skeletally on sex education. That's good enough. But I think that as people are growing, the church has a role. The church has a role to play, especially because more so that when people are going to get married, they are going to pass through premarital counseling.
Yes, premarital counseling.
Now, for God's sake, these people. You are told that. Why are you laughing now? This is it's a serious thing.
No, it's
yes. Okay, we are told. Okay, we have managed to, let's say, deceive them that this thing is bad. Yes, so that it's deception because there's nothing bad about sex in itself. It is how it is used. Yes, used exactly. That is where it can be a sin, or So let's say we have managed to take them through that journey, and now they found themselves and they are going through that premarital counseling, where that sex is going to be inevitable and even instant, because after eating food from the reception venue, the next thing you're expecting them is honeymoon. Yes, and of course honeymoon is not prayer. It's not it's not a retreat. It is not prayer retreat now. Is it prayer retreat?
It's like something.
That is what we are saying. It's the same. It's part of what I'm saying. If at that stage these people are taught practically what to expect, I think that at this point, no matter the denomination, you have the opportunity to rescue a set of people.
Yeah. So there's a big role. That's a big role.
Yeah, so
this is church can play.
Exactly. This is not the time where you're keeping quiet again.
Yes.
At this point, they should be. I think that is why I love this man, Dr. Mills, Dr. Mills.
Yeah.
He wrote a book, The Modern Marriage. And in the modern marriage, you see the practical, vivid, pictorial illustration of the male reproductive system, the female reproductive system, and their functions.
Yes.
And if you read the book, you will understand the step by step approach on how this thing should be done.
Yeah, absolutely.
And if a book like that is adopted for such purpose, because sex in marriage should be a very important topic. In fact, it should even be one of the most important. It should be the core course. Since
it's not an elective.
It's not an elective. No, since we don't have it, since most churches there's no kitchen where you say, okay, let's run practical in cooking. That would have also been a core course to be sure that the woman can cook and the man can also try. Or maybe the man can cook. Either way. Yeah. Do you understand?
Yeah.
But at least I think sex. Because most times you happen to see marriages that will break because of food. Just a few. But most marriages may not succeed the first 3 months on account of sex. So I'm thinking that at that point the church has a lot to do.
Yeah, I think that the church has a role to play, especially at that point where people have come to be counseled before they get married. It's important to hear it from the same church that has told you all these years that this is right.
Not just the church, the same people.
Yes.
And the pastor, the elders.
Yeah. So it's important to hear it from the church that this is good. This was created by God, and it is for this purpose that it was created. And it was not created for the man. It was created for the man and the woman.
The wife.
Yes. And it is not just for procreation. It is for enjoyment. It is for pleasure, and not just for co-creation, for bonding, for everything that
for intimacy. For intimacy.
So it's not just something that you must do because you have to. No, it's something that was made for you. It's something that was made for you, and if something was made for you, it means it was made to serve you. It was made to help you achieve, certain things, setting goals and all of that. So it's important for these young people to hear it. I, for one, would have been the better for it if this was talked about during our premarital counseling. Yeah. I wouldn't say that I suffered or experienced vaginismus, but I think that I experienced this what's that thing called again? Dyspareunia. Yes, I experienced that for a very long time, which is painful intercourse for a very long time and I think that it was 100% my mind not accepting this thing. Yes, there was no infection, there were no issues physically. It was just my mind not opening up to it. So you would see that my body will be tight.
Thanks to me.
My body will be tight, and it took years, right, to be able to embrace and accept and be at home, with the whole idea of sex. So I think that it's something that should be talked about more. People are suffering. Marriages are suffering. Marriages are even breaking. Yes, because of these things.
Yeah.
So it's important that young women are helped and young men are also helped to some extent, because it takes some level of awareness, right? To cooperate. Yes. So it takes a level of awareness. They also need to understand how the female body works and how women are wired generally. They need to understand that for women, sex is more emotional than physical, and if emotionally they are not okay, then it will be difficult. It will be very difficult to experience any pleasure whatsoever. So you see that women use the word give for sex a lot. So they would say, I gave you sex, or I'm giving you sex. And even men use that word a lot. You didn't give me, or you're not giving me.
I do. Right.
You're not giving me. So I think that even goes a long way to tell us the inclinations that we have about these things. Men feel like it is women that need to give up. Women feel that they are giving, they are sacrificing, they are doing the man a favor a lot of times. And so those things, I believe that if they are talked about before marriage, especially during premarital counseling, to go a very long way.
Wow.
Yeah.
What a topic it has been. And okay, before we call it a wrap, I think I will also like to say, for those people who may be, knowing about this for the first time and probably they're encountering something like this, just understand that you are not sick.
Yes.
You are not sick. You don't have any medical condition. It's just a psychological thing.
Yes.
And it is 100% curable.
Yes.
Just positive affirmation.
Yeah, I think that it's also important to also see a
therapist.
Yeah, a gynecologist. Go to the hospital.
Yes.
Has to see a gynecologist. Make sure that you're comfortable with whoever it is. Yes, and you can especially request that a female attends to you, and then it helps also to go with your husband or someone else that is close to you that you trust, for that emotional support. And but they will ask you a couple of questions. Yes, and look at your history. They will also do maybe some examinations and all of that to even kind of ascertain, and then the history mainly would also help them. And once you're diagnosed, they will tell you openly that it's not medical, it's psychological, and so they will recommend the required therapies and a lot of just therapy related things like exercises, like affirmations, like a few things here and there. Really, that would be recommended.
All right, thank you so much for being a part of this amazing discussion. I know that you are not the same again. So please do well to comment, send in your questions, leave a question, subscribe, and then share this video with someone.
A lot of people need to see this, especially our Christian ladies. We need to hear this. We need to hear this. I wish I heard this before the time that I was hearing it.
So thank you. We can just keep talking about this. So thank you. Please, God bless you, and do have yourself an amazing time. Bye. We love you.